YouTube, before we jump into the video, make sure you check out my Patreon account. It's designed for serious medical aesthetics providers just like you.
How are you?
I'm very good. I'm very pleased to meet you. I just got back from the gym, sitting in the gym, watching one of your videos and thinking how many similarities we have in common, which is obviously you're in business with your wife as well, your partner and your business partner.
That's right.
Got 2 young kids. You pump out amazing YouTube content, which I really highly recommend everyone who's watching goes and checks you out on YouTube. I was thinking actually before we dive into the main topic, what is the main compliment you get from people? Is there a theme that you get on your YouTube comments?
You know, it's shifted recently. So before it was just more, you're the nicest. I'm like, okay, that's great. But, you know, I'm not here to be nice. I'm here to educate the public. They appreciate the honesty, I think. And they appreciate that in a world of social media where there's a lot of fluff, I'm pretty honest about realistic expectations. And I go through a little bit of anatomy and also the benefits of medical aesthetics.
Yeah, absolutely. Well, I'm not surprised. I mean, sometimes people say I've got a calming voice, but I think you absolutely take it to the next level. It's like lubricated learning. It just goes straight in your ear effortlessly. I don't know when I first saw your videos, but it was a long time ago. And you know, you've just kept going and growing, and it's great to see. And I really admire your ability to implement and get stuff out there, and you're doing a great job. So I'm very proud to have you on and to introduce you to my audience.
I really appreciate that. To be honest, recently I made the plunge and I started going into doing these TikToks or the Instagram reels, and that's because of Miranda. So thank you, Miranda, for encouraging me to do that. I remember when she said, you know, you just got to do it, and she gave me the pointers. I was like, okay, I got to do this thing. So I jumped in and I'm all in now. So I appreciate that. Fantastic.
Well, we're inspiring each other. That's great. So male patients, hot topic. We've had lots of people ask questions about it. I think it is a tricky topic because I'm sure it's the same where you are, but we're heavily female dominated. It's still, I think internationally, about 90% female, 10% male, which means when you first start out in aesthetics, you're 100% female, and then you gradually start to get men in the in-between phase. And it's a little bit daunting for many people because they are different. It's worth being clear that I'm picturing very masculine, heterosexual men who are kind of, if you want to create a stereotype, we would call them blokes, like straightforward, no-nonsense blokes, because I think that's probably the rarest type who come and see us, and they are different, and it took me a while to figure it out. And obviously we are men ourselves, so we've got those insights, but it would be good to share with our largely female audience, actually, and hopefully we can make it better for them when they first see a patient. So have you noticed a difference with how they present to you?
Yeah, they're a little bit more straightforward. They know exactly what they want, and if they're coming in, it's for something specific. And they also, I mean, everyone loves attention to detail, but whenever I'm dealing with men, I'm really taking out a lot of my measurement tools, and these actually really help me. They really appreciate it, and that's something that they extremely feel comforted with. So for me, I do, you know, we do a detailed analysis of the face, but with these instruments, I'm giving them a lot of reassurance prior to ensure that I'm not going to overinflate them, they're not going to look puffy, and they're not going to look feminized. And I take my time with them, giving them certain measurements to ensure and make sure that they understand what's going to happen. I will not start until they have a full, clear idea of what our plan is. And I find that men, like you said, blokes, are just, you know, men who want to stay looking masculine, they really appreciate that.
So that kind of precision, eye for detail. I've read about this in a book. There's different ways that people make decisions, and some are very logical and analytical, and some are like more emotional and broad. And you'd say it sounds like they're more. Well, I don't want to say it's such a tricky subject, isn't it? Because of stereotypes.
Yes.
But it's that kind of practical detail that reassures versus your demeanor and other things that maybe other people would rate differently.
Absolutely. You're 100% correct. And it's just taking that time, making sure that they are clear and they understand that I'm clear that no, there's not going to be any feminization here. We're going to essentially keep the structure that they have. If they're lacking in a certain area, or if they just want to look, you know, a little bit more awake, then we can do that. I think everyone, whether, you know, if it's a man or a woman, or if it's feminization or masculinization, no one wants to be pillow-faced. And I think that particularly in these last few years, there's a lot of people who are hesitant to go into fillers because of all these pillow faces, these over-injecting clients. And a lot of people are afraid to come into medical aesthetics for that, and especially men. So that's the last thing. Most providers err on the side of natural, keeping everything natural. The problem is that sometimes you're going to go to a clinician who doesn't look natural themselves, and they're going to tell you I look natural, and it's like, well, there's only so much, that you can do with that. So if your clinician doesn't look completely natural, and they're going to assure you that you're going to look natural, there's a little hesitancy there. But men really need the assurance, and until the assurance is made up front, then we'll go ahead and continue. And there's a big difference there.
Yeah. So that, I mean, I totally get it. There's a different level of fear, I think, with men, because unlike women who will be very supportive of each other, men will destroy each other in a comedy way, if they think someone's gone too far. So the guy on the building site who's had his lips done is going to be crucified, possibly for decades. So whereas most women, maybe they'll say something negative behind the back, but mostly they'll support her, and as long as she's happy, which is lovely. But there's a definite difference there, which is worth knowing about, because if you can tap into that fear, then you know why you sometimes need to do more talking, more reassurance. So I can understand now why those measurements would be a big part of it.
There's a comment that I just read while you're speaking that said, they never rush. They make sure that the consultation is done prior. And with a guy coming in, I've even had it to the point where our appointment was almost done, and we still need a little bit more reassurance. So at that point, I just let him know, hey, by the way, we may not have time to actually go ahead with the procedure today. You can come back maybe later on in the day or maybe the next day, but I just want to make sure that we are on par here. And they really appreciated that. I thought that there was going to be, maybe disconnect, or immediately they were going to leave upset because they didn't have the procedure done, but they really appreciated that. They understood that I was taking my time, and they want to make sure that they were heard.
Yeah, I've definitely picked up more of that kind of pragmatism, just basically straightforward, accept things as well. As long as you get the digital stuff right, they don't necessarily need a lot of fluff. It's like, to the point, can't do that, have to do it another day, and that's fine. I'm not saying that women aren't like that, but it just feels more practical that I'm used to. Pragmatic would be the word. And obviously everyone's different. But we are, by the way, everyone, we have to be stereotypical, but everyone's different. And you can be a masculine man and be totally different to this if you want. But we're trying to pick up a pattern for educational purposes. So I won't mention that again. So what in terms of the presentation, do you think men present with different kinds of problems? What would be a kind of more typical way a man would say, can you help me? What would they be looking for?
Most of the time they come in with an idea, right? So men usually will want either masculinization of a jaw, so just a more projected jaw, or they just feel like their jaw is weak and they don't really understand how it's weak. They just know, they bring in a photo and they're like, I want Henry Cavill's jawline. And I'm like, oh my gosh, okay, you're going to need like a lot of filler here. But we go through realistic expectations, right? Because there's, again, a lot of fluff on the internet of, what people do and what they say they've had done. And you can tell it's likely altered in some way. So we make sure that if they're coming in for a jawline, we give them realistic expectations. Most commonly for me, it's men coming in who want a jawline done, or if they're having problems with the mid-cheek and tear trough. But I've had men who come in and just said, I would like your overall evaluation and give me a recommendation in order to make me look like myself, but 5 years younger. That's, I think, the difference between men who want to, stay looking masculine. They don't want to look beautiful. They want to look younger. And they want to look like themselves and younger. And potentially, if they can accentuate certain attributes in order to help keep them looking masculine, great. Yes, that can happen too. But for women, I feel like, yes, they want to look younger, but at the same time, there's a lot more of them that kind of want that beauty aspect. They want to look better. And I think there's a slight difference there for men. So, yeah, jawline, mid-cheek, and the tear trough.
Do you find older men and younger men different in your practice? Do they present with a different attitude towards it?
Yeah, older men, most often it's around the eyebrow, temple, eyebrow. They feel like they're getting a lot of hooding here. I just explained basically the orbital rim, how it expands, and there's a little bit of an involution here where everything kind of falls in. So fillers and Botox may not be able to give much lift, but by doing it's kind of like that. I don't know if you've seen that chic lift where you're just filling a little bit of filler underneath the eyebrow, fanning it across here, and also placing a little bit in the temple. It's definitely nowhere near as an upper blepharoplasty, but it does open up the eye a little bit and just helps with the hooding. A lot of more mature men I do that for, and then at the same time, it depends if they're fit or not, right? So that's a separate entity. So if I have men who are coming in because they work out all the time, then they usually have a nice defined jawline, but they've lost a lot of fat, particularly in the mid cheeks, right? It seems like their face is kind of caving in on themselves. Where if you have a mature man who comes in and they haven't been working out, then they've likely lost some definition here. So we evaluate that. Sometimes I'll have to go mid-cheek, and sometimes I'm going to have to go jawline.
Thank you. That was, I mean, you really had a fantastic, holistic interview. We've covered so much.
Yeah, I appreciate everyone who's been here, and this has been amazing.
It's been a pleasure. Really, really good talking to you, and I'm sure we'll do it again sometime. But it's been a pleasure talking to you, and yeah, thank you for all the stuff you put out.
And if I'm ever in a conference down there, then I'll stop by and say hi.
Absolutely, that'd be great.
Okay, take care.
Thank you very much, Dan. Bye-bye. Good night.